Hello, my name is Christos Krasadakis. I'm an oral maxillofacial surgeon based in Athens, Greece. We have this clinic that is called Face of Athens, and we perform a lot of advanced facial and neck surgery, such as facelift, reconstruction after trauma. We do a lot of oncology patients as well, but our main focus is on cosmetic facial surgery, such as eyelid surgery, buccal fat removal, facelifts, neck lifts, platysmoplasty.
What is a maxillofacial surgeon and how are they different than a plastic surgeon?
Maxillofacial surgery has to do with this. Maxillofacial surgery is the surgery in the area of the face, the neck and the oral cavity. We perform surgeries from the bone tissues till the soft tissues, whereas the plastic surgeon, they perform surgeries in the whole body, but they deal themselves mostly with the soft tissues, not with the bone stuff.
How many maxillofacials are there, very roughly, and how many plastic surgeons are there in the country?
Actually, maxillofacial surgery requires 15 years here in Greece. The active maxillofacial surgeons are roughly 150, whereas plastic surgeons in Greece are 3,500.
And if I wanted to do something to my face, who should I go see?
Both of them.
Both?
Yeah. That's why in our clinic we have both plastic surgeons and maxillofacial surgeons, such as my colleague and partner, Diamantis Bournakis. He's a plastic surgeon, so we perform all of our facelift surgery together, and that gives us the advantage of both specialties.
So let's talk a little bit about red flags and safety. What are some of the biggest red flags that a patient should look out for when they're researching a clinic or a surgeon in another country?
You have to be really careful with the price. If a surgeon is really cheap in his own country, that means something. You have to check all the before and after photos. You have to have photos with the actual scars, and you should have the consultation with the doctor that is going to operate you. It's really common to have even persons that are not doctors to consult you and someone else operates on you. The questions you ask them, the answers you are going to get are really typical, short, and without scientific background. And actually, they can sell it better than us. Many clinics focus on marketing, whereas here we focus on medical background we have. So it's really important for us to give an analysis to the patient, what the surgery means, what the post-op period is going to look like, and have all the follow-up with us. Sometimes that means that we have to say no. A salesperson is not going to say no ever. Sometimes patients come to us, they ask for extraordinary stuff we cannot provide. So if I promise something, that means I can deliver it. So probably I would have to deny that.
This obviously leads to the point about patients and what's a realistic expectation and what's an unrealistic expectation when it comes to plastic surgery.
There are a lot of patients with body dysmorphic disorder. There are a lot of patients that haven't understood what a cosmetic surgery is going to provide. So it's really important for us to set the expectations. Most of the time we lower the expectations, and it's really important to promise things that we can provide. The unrealistic expectation would be someone to have a photograph with them and wanting something similar, like a friend of them or a famous person. This is really common. They want their face to be done like that. This cannot happen. We have your own skeleton. We cannot change that with a facelift. So it's really important to understand what you should expect after one. It's not that dramatic that it sounds. We have to bring your own face, the natural face you have, with the proper proportions.
In your careers, things like Instagram and TikTok, with Facebook and LinkedIn have become more and more popular. We all have our faces everywhere on the internet. We can search anybody's face, whether they're famous or they're an influencer, that this affects people's expectations and even their version of reality when it comes to looks.
Before the conversation, you showed me a picture of before and after from a facelift, and I told you this is not real. This is a filter from Instagram. So it's really important for people to understand that sometimes what they see, it's not realistic. It's not real life. It's only filters. So they have to expect a really good result, but not becoming a different person. this cannot happen. And actually, we don't want it to happen. Sometimes people come to us and they said, I want to look like when I was 25 and 30. And if you compare a lot of famous people when they were 25 and 30, actually now they're in their 50s, they look even better. So we have to provide a better look, but concerning the age of anybody. We cannot, return to a previous decade, actually.
If you were giving somebody advice about going abroad and what to look for in a clinic,
first of all, check the doctors, check their resumes. It's really important for their medical background. Where did they study? Where did they train? And check their website, check their results, probably their social media. Check if these results are realistic, because as I told you, if you see completely different faces, probably it's going to be a filter. And see them, how they talk, and find out if you want to leave your face be operated by the man or the woman that you're checking.
Prices are very high in America. Even in countries like the UK, they're very high. £30,000 for a facelift. In America, $130,000 plus dollars. Are you seeing international patients come to your clinic?
So we have a lot of international patients coming to our clinic. It's really important to understand that although there's a gap between the fees that they are charged in the States or compared to Greece, that doesn't mean that we're cheap for Greek standards. We are expensive, but Greece is a cheaper market. As I can say, as I told you before, Greece produces a lot of good doctors. So other countries may produce oil, Greece produces good doctors. So the level is really high, there's a standard level, and you can find a lot of good doctors in any specialty. We focus on facial surgery, and we have trained a lot, also in Greece, in Europe, and also in the States.
Why does Greece produce such good doctors?
Actually, it's really difficult to enter the medical school. It's really difficult. We give exams, the most difficult exams that I have ever given in my life, in order to enter. So the level is really high, and it's really difficult to enter the specialization as well. Actually, maxillofacial surgery is a dual specialty, so it requires both medicine, dentistry, 1 year of general surgery, and then we have 5 years of facial surgery. So in total it's 15 years just to finish all of this training.
But you also trained in America too?
Yeah, actually I go training not only in Greece, I was also in Germany and also in Virginia, America. I got a lot of extra training on cosmetic facial surgery, which made me what I am today, because I saw the whole picture, not only from the European standards, but also from the American ones.
So for an American who's looking at, say, doing a facelift, and they see that the price in New York is $130,000, and the price in Greece is around $10,000, what's the catch?
There's no catch concerning the scientific part. The catch is that an apartment in New York costs probably $5 million, and an apartment in Athens costs about $900,000. So that's the difference. The difference is in the market, not in the scientific part. Don't worry about having a less good doctor.
It doesn't matter what country you're in, doctors watch just as much.
Of course. That doesn't mean that everybody is trained to do that. That doesn't mean that if you come to Greece or Athens, that means that everybody can operate and give a good facelift. You have to have a background for that. And you can see both faces in every place.
How many facelifts do you think you do in a year? Very roughly.
Roughly, I do about 100 facelifts per year.
Out of the 100, how many do you think have any complications to them?
You know, complications in surgery, more common than you can imagine. Simple complication is really common. have some minor bleeding or some seroma. Seroma is a liquid that gathers between the skin. These are complications that we see in the first days, and we can easily maneuver. We can just aspirate, we can just do some things, and this subsides. Really important complications are rare, and if you operate a lot, you might encounter some of that. But the important thing is that we manage all of our complications. We don't refer to other clinics. And the other important thing is that when a patient is operated by us, everything after the operation that has to do with that specific surgery is covered by us. They don't have to pay again for a revision. They don't have to pay again just to have a solution on the complication. And you know, if somebody says, I don't have any complications, they don't give surgeries or they lie to you. For someone coming to Greece to have a surgery, usually we ask them to be here 3 to 4 days before the surgery. But most of them, they take the advantage, they come here for a couple of weeks to visit probably the Greek islands or Athens as well, to see the country, which is really beautiful. After that, they come to us to meet us in person, because we have talked a lot through WhatsApp or Zoom or Viber calls, and we meet them in person. We explain a lot about the surgery they are going to undergo, and then we perform the surgery, and after that we ask them to be here at least for 1 week. That means that we are going to put absorbable sutures, and if they can manage to be here for 2 weeks post-op, then we don't use absorbable sutures, and we remove the sutures 2 weeks after the surgery so that they can go safely back home.
And then how do you follow up with them once they go back home?
You know, every patient here has my own private phone number. They can text me regardless the time. Usually when they feel anxiety about something, they send me a photograph, and then we talk a lot about if this is normal or this is something that I have to check again. So we have a lot of WhatsApp calls talking about the post-op period, which is really mild if we talk about a facelift. You know, eyelid surgery is more, has a lot of bruising, although it doesn't hurt, the patient's like that. With a facelift surgery, you know, the patient doesn't bruise a lot, the swelling is mild, so usually they don't feel no pain. We prescribe painkillers, they don't take them, they stop them. So actually the post-op period is really simple. It takes about 2 weeks for the major swelling to subside. It takes about 2 weeks for the mild bruising or the bruising they're going to have to fade away. It takes about 1 month so that they start liking the result. In the 3rd, 4th week is like the best thing that they have ever done. They start thinking about it. And the final result is about 6 to 8 months after the surgery. So from the 3rd week till the 8th month, it's all improvement after that. It takes about 6 months to achieve the color of the skin, because in the beginning there's a redness in the tissues, but after 6 months usually there's no visible scar.